All right, this other short lecture is on scoliosis. Most of you have probably heard of scoliosis and what it is. It is an abnormal curvature of the spine, and it's a deformity rather than a specific disease or a disorder. And so, like in osteogenesis imperfecta and some other conditions, scoliosis is sometimes a common related deformity. So there's a lateral curve of more than 10 degrees that's present. And so I remember back in school, they had initial screenings and they would do the Adams forward bend test. So the Adams forward bend test, like Adam and Eve, Adams forward bend test. And so from there, you can see it usually was administered by school nurses. And so the patient's asked to lean forward with his or her feet together and bend at the waist around 90 degrees. The examiner can then view from this angle any asymmetry of the trunk, any spine curvatures or anything like that. And so just looking on the right hand side here, you can see this lateral, how the spine takes this lateral curve here. Another prominent thing is looking at the shoulder blades or the scapulas here. One is more pronounced than the other one. Also right here, looking at the hip, how one side of the hip is hiked versus the other. And so this isn't the best picture, but when they're bent over in that Adams forward bend test, you can see that this side of the scapula is higher than this one. You can see how there's kind of a dent right here in this guy's trunk, and his hip is higher than on this side. And so by doing this simple screening, you can pinpoint or identify that curvature of the spine. There's different types of scoliosis. There's a functional scoliosis, and this is usually flexible and can be caused by simply poor posture or a discrepancy in leg length, one leg longer than the other or shorter than the other, having poor postural tone, so that poor trunk strength. That's why that trunk strength is so important in trunk stability. Hip contractures, if somebody has a hip contracture or meaning their hip is maybe hiked on one side versus the other, or if people are in a lot of pain. People tend to be in that fetal position when they're in a lot of pain, and so their spine may be curved and they may keep it that way. Congenital scoliosis is present at birth, and it's structural in nature, which is caused by abnormal spine or abnormal spinal cord structures in some way, shape, or form. So they're born with it that way. It can be neuromuscular also, meaning that somebody with cerebral palsy, osteogenesis imperfecta, or osteopenia, that's another kind of condition, osteopenia, that has to deal with the nervous system. Osteopenia is just taking apart the words. Osteo has to do with bone. Penia, I believe, has to do with your bone density. So there's a low bone density if somebody has osteopenia. Sometimes it's syndrome related, and so we'll talk a little bit about Marfan syndrome, where it's marked by rapid excessive growth. And then there's idiopathic scoliosis, and this is just when scoliosis occurs and we don't really know what the cause is. This is a picture of people with Marfan syndrome. They're usually really, really tall with long, thin arms and long, thin legs and spider-like fingers. Long spider-like fingers is a condition called arachnodactyly. And so sometimes, or a trait of Marfan syndrome is when the people hold their arms out from left to right, the length of their arm is much greater than their height. And so how many of you are going to measure how wide you can stretch your arms from side to side and then see if your arm length is actually longer than how tall you are? Doesn't mean that you have Marfan syndrome though. Idiopathic scoliosis, nearly 85% of all scoliosis cases are of this, and so we don't know what the cause is. There's different types. Infantile idiopathic scoliosis, looking at ages 0 to 3, is only 0.5% of the incidence. Juvenile 4 to 9 is 10.5% of the incidence. And then we look at that adolescent years, and there's that bones are hardening during this time, and people are going through growth spurts. And so we have the 89% of idiopathic scoliosis is occurring in are from adolescents. Sorry. So scoliosis symptoms, again, you're going to have uneven shoulder blades, or one shoulder blade sticks out more than the other. You're going to be looking at uneven waist, one hip higher than the other. Maybe they're leaning to one side. And people also have fatigue with scoliosis as well. So you can kind of see, here's a picture of a little girl with scoliosis. She's got the uneven shoulders, so one's higher than the other. The shoulder blade is sticking out a little bit more, and that waistline is uneven. So girls usually are likely to have a progression of curvature of the spine. The younger the age when scoliosis appears, the greater chance that the curve is going to progress and get worse. The location, so the curves that are in the middle to lower spine are less likely to progress than those that are in the cervical or upper parts of the spine. If there's spinal problems at birth, children born with scoliosis have a greater risk of that curvature progressing. So again, curvature progression just means that the curve will get worse on its own. It'll progress over time. TLSO, I can't seem to move these pictures here. This should be TLSO, thoraco or thoracolumbo-sacral orthoses. And so you can have an underarm or a low profile brace. So this last word here is brace. Sorry about that. It fits under the arm. And so this one on this side is actually the Milwaukee brace, and it's a full torso. You see that it goes up to the neck even, and then has a flat bar to give it that rigidity and stability, and to try and keep that spine nice and straight. So a little bit more complex than, say, an underarm or low profile brace. Surgery is done when they recommend, or surgery is recommended if the curve is greater than 40 to 50 degrees. And sometimes they'll put in what's called growing rods alongside the spine, and they will anchor them into some of the vertebrae. And then as the individual grows, the rods actually will extend also. So it involves techniques that fuse or join the vertebrae along the curve. So they also may fuse those joints to make them nice and straight. And it's a very complicated surgical procedure. You can imagine if you're fusing vertebrae and you're putting in growing rods and drilling them into the vertebrae themselves. So hospitalization can last 5 to 7 days, and there's activity restriction usually for several months. And so here you see on the left-hand side this lateral curvature of the spine. Here they put in growing rods, and so you can see that they attach them to some of the vertebrae, and you can see this is metal going across here, and then there's big bolts right here into, I'm assuming, the lumbar spine. And here's a side view, so it's nice and straight. These rods again will grow as the person grows. So OT's role, we're going to be doing a lot of activities of daily living. If somebody has growing rods in here, they're not going to be able to bend as far down as possible. You may be working on transfers, especially if they're still in the hospital. You may look at wheelchair positioning or mobility. Certainly education, on educating on transfers and ADLs and maybe lifting precautions, because certainly after surgery they'll have lifting precautions, as well as different ergonomics on how to get dressed, or if they're going back to work, or for school and handwriting and sitting at a desk and all those sorts of things. Here's a short YouTube clip about a dad who is donning an underarm or low profile brace. Sometimes some people call them turtle shells too, and something like that, I guess. But just to kind of give you a visual of that other kind of brace and how complicated they are to put on sometimes. You have to get them really, really tight. And then you have that hard material constantly putting pressure on the side of your spine or on the side of your trunk to correct that curvature. And so, it's not uncommon to get red areas and skin breakdown and some of those kinds of things too. So that's going to help or be part of that education role that we have too.